Okay, first up, our first speaker is Dr. Nash. He's going to speak to you on Alzheimer's research, a physician's personal connection. And again, if you look in your little agenda there, you can see a write-up on him. And one of the things I found fascinating is he's an avid organic gardener. And I don't know how many of you are into gardening or organic gardening. It's a lot of work. It's a lot of fun. It's very rewarding. Something that I highly recommend because I am one, I are one. So without further ado, Dr. Nash.
Let's do me some water here. So after 10, right? 10?
Yeah, I'll give you a sort of high sign when it's close to it.
It's about 40 minutes.
Yeah.
Okay, can everybody hear me? You hear me okay? Let me practice a little bit, okay? All right. Just like playing video games. They asked me to talk about clinical trials in studying Alzheimer's research. And I have a close ties to Alzheimer's disease. I view it from three different viewpoints. Sometimes I get a little teary-eyed, so bear with me. So I view it from three viewpoints. I view it as a family member and as a long-distance caregiver. My mother and younger brother died with Alzheimer's disease. My father probably had it when he died. My older brother was diagnosed about a year ago with Alzheimer's. And then I view it as a family doctor. I used to treat Alzheimer's patients. But knowing everything I know now, I realize I really didn't do a very good job of it. And then I think what makes my situation a little different is I also view it as a patient because I have amnestic mild cognitive impairment, that's short-term memory loss. It's that precursor stage to full-blown Alzheimer's disease. I take the medication Aricept, donepezil. You guys know what that is. It's usually what you get started on when you first get diagnosed with Alzheimer's disease. I've been on that for 5 years, and that's the reasons why I discontinued practice was because I was diagnosed. I am in a large research study called the Alzheimer's Disease Neuroimaging Initiative, ADNI study. I've been in it for 5 years, and if I don't get into the new treatment study that I'll tell you about, I plan to go to the phase 3 portion of that will start up in August. I want y'all to, there's a couple of words I want you guys to know if you read much about Alzheimer's disease. One is called, these are two proteins associated with Alzheimer's disease. Beta amyloid, many people believe that that's the protein that causes Alzheimer's disease. Not everybody agrees with it, but right now that's the theory. It accumulates in the brain, destroys the brain cells, and causes Alzheimer's disease. The other protein is called tau protein. It's a protein that usually shows up after beta amyloid. It's a protein that forms the microtubules in the brain cells and the nerve cells. And when the beta amyloid comes in and gets damaged, later on the tau proteins unwind and they start floating around in the spinal fluid and eventually get in there with the beta amyloid and forms tangles, and you get a lot of oxidation, inflammation, you get plaques formation and brain cell destruction. Okay? That's the theory of what's going on with Alzheimer's disease, and that's where a lot of the treatment studies are trying to do something about these two things. Okay? This, on the left side, is a healthy brain. On the right side is a brain from someone that had severe Alzheimer's disease. You don't have to be a pathologist to see the total destruction of the brain that occurs with this disease as it progresses. Now, right here, in this area here is the hippocampal area. That's where your short-term memory is processed, okay? And that's where that beta amyloid and that tau shows up first, is right there, okay? It starts there, and as the disease goes on, and I'll show you later, but this starts years before people have symptoms. And then it'll travel across the brain, and where it goes to determines what kind of symptoms that you'll see in a patient. Okay? My story. Because I had it in my family, I applied for long-term care insurance about 8 years ago because I wanted to be ready if it happened to me. And I went up and had to do about a 30-minute memory test. And they asked me all these questions. I got 100% of them right. Okay? And about 3 years later, I decided, okay, when I reach a certain age, then what I'm going to do is I'm going to be monitored on a regular basis and checking my memory. And if anything showed up, I was going to stop practicing medicine and call it quits then. So I contacted the Alzheimer's Center up at UT Southwestern and explained what I wanted. They said, well, why don't you get in this ADNI study, and we'll do all these testing on you that you have done. Plus, they got all this new stuff that's not available out there in the private world. So I said, okay, and I went up, and I had one of the first things they did was a neuropsychological test. Anybody had one of those? Okay. It takes about 2 or 3 hours, and they do all kind of things to you, testing your memory. But they were asking me these questions that were just like the ones I'd done 3 years before. And I can remember sitting in this chair at the table looking out through this window. It's the same window I have to look at every time I go up there for the testing. And I can remember getting this cold sweat because I couldn't remember the stuff that she was asking me to repeat back to her. And that was kind of that moment when I realized that I had a problem. And then I had a problem with the spatial part of the test. I had a problem with the spatial part of the test, which goes along with the early signs of Alzheimer's, recognizing pictures and naming what they were and doing drawings and stuff. So about 3 weeks later, I get this phone call that says, Dr. Nash, we want to call you before you get this letter in the mail. Looks like you have short-term memory loss that's greater than it should be for your age and degree of education. And we really think you should see a neurologist. And they said, we'd like to have this lab work, and we'd also like for you to have an MRI scan before you come up. And so I also got to thinking a lot after all this happened and started thinking about things that happened in my practice. And I realized that I was missing things at work. I recognized it, but my nurse didn't, or my wife didn't. Those two people I was around the most every day. And they didn't notice any issues. But looking back, I noticed things. And I was missing things, but luckily my record system and my nurse kept it from showing up in my practice. So I saw the neurologist, and she said, you know, you have early mild cognitive impairment, amnestic type. That's short-term memory loss. That's the precursor to full-blown Alzheimer's disease. And we really think that you should consider getting on the medication Aricept or donepezil is a generic version. I'd already read about it, and I realized the sooner you get started on this stuff, the better it works long term. It doesn't stop the disease, it just slows the symptoms down. And she said, we're basing this on the fact that you had a normal memory test. 3 years later, suddenly it's abnormal. You have a real strong family history of Alzheimer's disease, and you've been noticing stuff. And you put all that together, and you know that's what you have. And I decided that I wouldn't return back to practice, and I never returned back to practice after that. So that's my story, and I'm sticking to it. So the ADNI test is Alzheimer's Disease Neuroimaging Initiative. I'm in the phase 2. There was a phase 1, now this is the phase 2, and they're going to do a phase 3. So I want to go over the testing they do, because if you go into a doctor because you're having memory issues or your loved one has memory issues, these are some of the tests that they should do on you, and if you don't, you probably didn't get a good workup. So the first thing, the old standard history and examination from the patient, you're looking for things that, why does this person have memory loss? Do they have sleep issues? Do they drink too much? Are they on drugs that affect them? Are they having sleep problems? They have sleep apnea. They have poorly controlled blood pressure, poorly controlled diabetes, cholesterol. Are they under a lot of stress? Are they depressed? Looking for explanations. That's the first part when you go to the doctor, and the first thing they do on these studies. The next thing they do is labs. And here's the labs that pretty much everybody agree on that needs to be done. A complete blood count. All neurologists agree on this. A blood count, chemistry profile, looking at electrolytes, kidney function, liver function, and glucose. Is there something wrong there that could explain what's going on? And then a thyroid level. I found people coming in depressed or having memory issues, and they just have low thyroid. And the same thing can happen with vitamin B12, although it's not real common because it really has to get low for it to really affect your memory. So everybody agrees on that. And there's sort of a tertiary level that some people do. Not everybody agrees on this, but it's a vitamin D level, folic acid, an amino acid called homocysteine. If it's markedly elevated, it's associated with increased risk for Alzheimer's, stroke, and heart attack. Okay, and then there's that's what other people. Some urologists will do that, but not everybody. Okay. And then the next test that's done in the office, and also for this study, is you do some type of memory test, and usually you're going to do one in the office. It's called commonly it's known as MMSE, and there's one called MOCA. I call it the hot chocolate one, MOCA, MOCA test. It takes about 20 minutes. It's a pretty good screening test. And then if indicated, they may do the full neuropsychological test, and it can take an hour and a half, 2 to 3 hours. I even had an 8-hour one time. And then based on what that shows, then they do an MRI scan of the brain. Because someone may be having memory loss, but maybe they just had a stroke and you didn't know it, or maybe they got too much fluid in the brain, or maybe they already got shrinkage of the brain on the MRI scan, or maybe they got a mass in there. Okay, so or maybe they had old scar tissue or something like that. Explains it. Now, nothing really come up in my history and physical. My labs initially were normal, but I have a low B12, vitamin D, and an elevated homocysteine level. Now, in this study, you signed a waiver, like I signed a waiver for them to photograph me. And I have to agree that I don't get these results. I'm not supposed to get these results. I'm not supposed to get them. And then so, if you have a memory evaluation somewhere, that's what you should have done. You work your way through. Now, in the study, they also do genetic blood tests and an APOE test. Now, the genetic blood test is testing you for a dominant gene that causes Alzheimer's disease. If you get that gene, you're going to get Alzheimer's disease at a very young age. That's that early age onset. And very rare, less than 1% of the cases. Okay? I don't carry that gene. I had some of these things I had done in the private lab. I had to pay for it myself because the insurance doesn't pay for it. So I do not carry the dominant gene. The APOE4 gene, that's a gene that's associated with an increased risk of having Alzheimer's disease. If you get the version 2, APO2, it tends to protect you. APO3, you tend to get a milder case. If you get APO4 gene, it's increased risk. If you get the double version, APO4, you have up to a 20 times increased risk of having Alzheimer's disease. Okay. Now, it doesn't mean you're going to get Alzheimer's disease, you're at increased risk, and really how you live your life determines how it shows itself up. So if you're really healthy, you can slow things down a little bit. I carry the APO4 double version. So I have a 20 time increased risk of having Alzheimer's disease. Okay. And then the next one is a spinal fluid analysis for beta amyloid and tau protein. I never thought I'd get a spinal tap. I've done them before. I used to do a lot of pediatrics, did a lot on kids. But I've had 2 done. And what they do is they test you for that, the bad beta amyloid and the tau protein we told you about earlier. So what happens normally in a normal person, the beta amyloid level's here, and you don't have any tau protein in your floating around your spinal fluid. And then as the disease progresses, the beta amyloid, as it gets deposited in the brain, the level starts dropping. And then as the tau protein gets destroyed, it starts climbing in your spinal fluid, so you can measure those. So someone with Alzheimer's disease has low beta amyloid and high tau. Now, I had mine done in the private lab 5 years ago, and I'm not here and I'm not there. I'm about right here in the indeterminate range. I'm due to have a tap this year, and I'll probably repeat it, and I'll find out where I'm at, okay? And then the next test is a glucose metabolism PET scan. Glucose metabolism PET scan. And that test, they give you an infusion of glucose that's radioactive labeled, and it goes to the brain, and the brain cells use glucose. And if you have a normal brain, it's highlighted everywhere on the scan. But if you have Alzheimer's disease, all those pockets where the Alzheimer's is just blank. There's nothing there. Okay, so you can do those scans. Now, the insurance does not pay for spinal fluid analysis. They don't pay for the PET scan usually. Okay. And then the next one is the ambient PET scan. That's a new scan that what it does is they give you an infusion of a substance that's radioactive labeled, and it goes up to the brain. And if you've got beta amyloid in the brain, it's going to be highlighted. So wherever that is, will show up as highlighted. So if you have Alzheimer's disease, this scan is going to be positive. And I'll show you what a positive looks like in a second. Okay? And most of these treatment studies, that's what they use to decide whether people get in the study or not. They have to have a positive PET scan. All right? It's available in this area. Everywhere, it's $5,000 to $10,000. Insurance doesn't pay for it. Okay? I've had one, but I don't have the results. They won't let me see the results. I'm going to have one this year as part of the treatment study. If I don't get in the treatment study, I'm just going to suck it up and have mine done so that I'll know where I'm at. Because I decided I want to know where I'm at. If I've got it, then I want to do as much as I can to slow it down. Okay? And this is just a scan, it's either an MRI, CT scan. That's somebody that had a stroke. So if they came in with memory loss, you'd say, well, yours is probably from your stroke. And they may not do all these other testing. Okay? Also, you can pick up shrinkage of the brain on the MRI scan. The other thing they do in this study that I'm in, I forgot to mention that on the MRI scan, is they've got a computer program that looks at that underneath surface of the brain where Alzheimer's starts, and they can pick up subtle changes in that volume of the hippocampal area. And so you can detect whether someone may be getting Alzheimer's disease a long time before the symptoms show up. Okay? Now this is the ambient PET scan. So on the left is a negative scan. So they get the infusion, it goes up in the brain. There's no beta amyloid up in there. It's just blank. That outer part is there's no redness there. And on the other side, this is someone with Alzheimer's disease. And you can see it's pretty diffuse. And if they're really advanced, it's even worse than that. Okay? So these tests are available. Some some neurologists are ordering them if the patient wants to pay for them. Now this is I call this the Alzheimer's graph. It's kind of busy. It's from the SNIFF Study. They took all this information they've accumulated and they put it in this graph. So if you look, it goes from birth to 100 years of age. This is sort of your typical late onset Alzheimer's disease, which is what I would be and my mother and my brother had. And this is the typical progression. And if you'll look here, look around 45 and go up here, and things are normal. And this first line here, you'll notice that in the mid to late 40s, these people, which would be me and my brother and my mom, they will have started accumulating beta amyloid already. This is 25, 30 years before they're diagnosed. And then a few years later, maybe 5 to 10 years later, that's when the tau destruction starts occurring. And it starts unwinding, and you get these plaques forming and all these tangles forming, and you get total brain cell destruction. Okay? And then if you go, the next thing that happens is the brain structure. So if you do that real sensitive scan they do in this study, they might be able to pick up changes that are going on before the symptoms will start. So maybe in the early 60s, you may show up with an abnormal scan, MRI scan, even though you're not having symptoms. And some of these studies are using this to try to diagnose people before they have symptoms. And then the next thing that happens, now this is memory. So the memory starts fading around 65. And what happens, I can tell you from experience, what happens is you notice it first. Nobody else notices it. Okay? And as time goes on, what happens is that you start noticing it, and then other people start noticing it. And somewhere in here, if they do a memory test on you, they may pick it up early on that you're having memory loss. But like on me, they picked it up on me, but nobody noticed anything. Okay, but I did when I really was honest with myself and looked back. Okay, and then as it progresses, and everybody starts noticing, then things get bad, and you get diagnosed, and then if you've got family members with Alzheimer's disease, it's a 10 to 15 year process after that, and it doesn't get better. So right now, there's nothing you can do to stop it. Aricept doesn't stop it. It just kind of slows the symptoms down. Okay? So I want to tell you about some studies, some treatment studies. Okay? This is kind of exciting. First thing I want to say is that, let's see. What if I could say, would you like to know if you got cancer? Would you like to know that if you had cancer? And if I said, if we could tell you if you got cancer and then we can treat it if you have it, most people would do that, wouldn't they? Okay. Well, with Alzheimer's disease, it doesn't work that way. Okay. People don't want to know. I've got relatives who probably going to get Alzheimer's disease, and they need to be in these studies, and I can't get them to get in it. And I think they're afraid. They don't want to know. Okay? I understand. But I've got two siblings they just live a few miles away from one of the centers, and they'd be great for one of these studies, but I can't get them to do it. Okay? I think Alzheimer's disease is worse than cancer because there's not a cure. At least cancer, you have a chance to survive a little bit. So I call this the Alzheimer's vaccines. And basically what they are, have you ever heard of, know anybody with like rheumatoid arthritis, ulcerative colitis, Crohn's disease, and they go in and get those infusions? They get infusions on a regular basis. I've got a sister-in-law that's been doing it for years. And it's really slowed down her rheumatoid arthritis so that she's pretty functional at 75. So these kind of operate the same way. Basically what they do is either you get an injection that makes the body makes an antibody against that bad stuff, the beta amyloid, an IgG against beta amyloid. And the theory is that it goes in there and it grabs that beta amyloid that we saw that's in the brain, and it snatches it away from the brain. And it removes it, and it's gone. Okay? And if it's floating around in there, it grabs it and removes it, in theory. Okay? Now, the first time they did these studies, they did it in people more advanced, and it didn't work. And what they found is, you can see how much, on that previous graph, when you're 50, 55 years of age, and you're going to get Alzheimer's later on, and you're at late onset, you really have a lot of destruction going in there, but you got so much good brain cells left. And so, I lost my train of thought there. But anyway, and so if you catch people early on, maybe you can do something about it, but if you wait too late, there's just too much destruction, just too much scar tissue, you can't fix it, okay? But what they notice in all these studies is that early on, they notice that people with early symptoms, that they seem to get a little bit better. And so now all the attention has been geared towards people with early Alzheimer's disease, people with mild cognitive impairment like me, or people who don't have symptoms at all. Okay? And then they're going to start treating those people. And those studies are going on now. The biggest problem they have is people aren't volunteering for them. They need people. Okay? I'm going to stay after my siblings to get them in them. So this is just a few of them. Eli Lilly has one that's called the SOL drug, because nobody can pronounce it, SOL drug. And initially they did it in more advanced and it didn't work, and they did it in the early people, well maybe. And so now they've got studies going on where they're going to see if it works. And so I'll jump down to A4 study. The A4 study is going to use the SOL drug. Okay? So what they're going to do, you got to be between 65 and 85. Your memory's got to be normal. You get tested for genetic test and the APOE4. And then you get an AMBID PET scan. And it's got to be positive to get in the study. You got to have normal memory, and you got to have a positive scan. Now, just because you have beta amyloid doesn't mean you're going to have Alzheimer's disease, but there's a good chance you are. And then what they're going to do is they're going to do a placebo group and a treatment group. And the treatment group is going to get this stuff. And they get it, I think it's monthly that they're going to be getting. No, probably monthly. I think this may be monthly. You go in every month and get the infusion, and they're going to follow them for, and there's handouts out there at my little table. They're going to follow them along for 3 to 5 years. And if it looks like it's working, what they'll do is those people will be able to continue on this drug, especially if it's going to get approved. So you could potentially be somebody like my siblings who are going to get Alzheimer's disease. They can go ahead and start treatment, and they'll be 5 to 10 years ahead of the game before it comes available to everybody else. So they may really slow things down a lot if it works. Okay. That's A4 study. It's done in several sites in Texas, across the United States, and they're begging for volunteers. Okay. The next study is the Columbia study. This is up in the mountains of Columbia. They're sort of an isolated, huge, extended family, and they carry this dominant gene for Alzheimer's disease. They have the highest incidence of Alzheimer's than anywhere in the world. They've actually done genetics testing and stuff, and they figured out that it came from a Spanish conquistador that brought it over and introduced it into the population back years and years ago. And so these people, they call it the madness, whatever the Spanish word is for the madness. They call it the madness. because there's such a high incidence there. And so if you get the gene, you're going to get Alzheimer's disease. So what they're going to do, and what it started last year. Now another company's making one. It starts with a G, no, CREU, Zamab. It's made by Genentech. And what they're going to do is you go in, your memory's got to be normal. And then they do the scans as baseline, do the neuropsych test, and do all that other lab stuff. And then they're going to start giving, now this one's given as an injection, a sub-Q injection under the skin. And it's going to be given every 2 weeks, and they're going to follow them over a period of time and see if it will, because they're going to get Alzheimer's disease. These people get Alzheimer's, they start having symptoms in their late 30s and early 40s. They usually die in their mid to late 40s, early 50s. And they're going to see if it works. And so in 3 to 5 years, we'll kind of start knowing if this stuff is going to work on these folks. So these people don't have symptoms yet. It may prevent it if we're lucky, okay? And so the good thing for the people in the study, they'll probably be able to continue on it longer afterwards, all right? So that's the Columbia study. The bottom study, I call that the ADO drug. It's produced by Biogene. That's the one I'm trying to get in. My problem is, every time I go up there for the research center, I'm begging, I want one of those treatment studies. I'm bugging to death. And they all know I want to get in one. But the problem is I fall through the cracks because I'm not normal, so I can't get in the A4 study. I'm not far enough along to get in some of these other studies. All right? And I'll tell you why in a second. But the ADO one, it looks like I may fit into that one. And I'll find out later this month, end of the month or 1st of April, if I get into the study. So what happens, I have to start all over again. And I go in, but I will get my scan, but PET scan. It has to be positive to get in the study. So if I get in the study, I know that I have positive beta amyloid in my brain pretty diffusely, okay? And then what I do is I go up every month if I don't get in the placebo group. I told them I don't want the placebo group. I want the treatment group. And they'll give me the infusion every month. I think it's up to either 3 years if I'm in the treatment group. And then there's a good chance that if it's kind of working, they'll continue in me in that study so that it gets approved. This, if it works, could be approved in 5 years, maybe 5 years. So I may gain 5 years of treatment. That may make a huge difference in me because the earlier you start this stuff, the better it works. Okay, if you wait too late, like when my mother was diagnosed, it was too late. My brother, it would have been too late. But for me and maybe my older brother, maybe he's a little bit more advanced than I am. Now, one thing about the ADO drug is when they do studies, they have to do phase 1 studies, phase 2, and phase 3. It's usually a 5 to 10 year process. So what they did was, in the phase 1 study, they take a small number and they're just testing different doses and make sure it doesn't kill anybody or anything like that. But what they noticed was that those people with early symptoms, 2 things happened. Their memory got better, and then when they did those ambient PET scan, it was pulling the beta amyloid stuff out of the brain. So it looked like it was working. So what they were able to do is skip phase 2, which would add another 3 to 5 years, and then go right to phase 3. So they're in phase 3 now. So it could potentially be available on the market if it works in 5 years. That's pretty exciting. Okay? So I'm waiting to get on that one. I got my fingers crossed. Now, if I do not get on that one, and I don't get on one of the others, I'm going to go ahead and do the phase 3 of the ADNI study, and that's open to everybody. And what they're going to do in the phase 3 of the study I'm in now is they have a new scan that finds that tau protein in the brain. It's like the ambient PET scan for beta amyloid. This one will be for tau. And so they're going to see where that fits into the picture. They're also going to do computerized memory tests that we're going to be doing on a regular basis. And maybe what they'll do is how patients, if you live in South Texas, they'll say, here's your link, go in there and take this memory test and send it to us. And so that we're the guinea pigs for that. Now, there's another drug out. I picked the two that are most promising, I thought was the most promising. It's called the BACE inhibitor. And there's two companies that are making that. I think it's Lilly and Biogen. And the BACE inhibitor is just real simple. You take a pill every day, and it goes up there, and it makes an enzyme quit making beta amyloid. So now you're not making the bad stuff. And they're thinking that may slow the process down, okay? And they're doing this study in all kinds of different places. And they're doing it in early mild impairment like me, early Alzheimer's disease. And they're going to start studies in people that don't have any symptoms at all, okay? APOE study, I think there's a Banner Institute in Phoenix is doing this one. So what they're going to do is they're going to find people like me that have the double version, APOE, 20 times increased risk for Alzheimer's disease. And of course, they're looking for people with normal memory, who doesn't have diagnosis, normal memory, APOE double version. And they're going to do two studies. One, they're going to treat them with the BACE inhibitor, one group with BACE inhibitor. So they're going to stop the beta amyloid from being produced and see what effect that has. And the other group, they're going to treat them with one of those vaccines, one of those antibodies. And I forget which one it is. But they'll be given in regular infusions, and they'll follow them long term and see if these people who have a 20 times increased risk of getting Alzheimer's, see if you can prevent them from getting the disease. Okay? So now you got people who have no symptoms, you're going to start treating them. Okay? Hopefully 5 years, this will know. So here's my vision is that, in 3 or 4 or 5 years, I'm going to get up in the morning and take my BACE inhibitor, that pill in the morning, and stop that stuff from being produced. And then I'm going to go down to my infusion center with the people with rheumatoid and stuff like that, and I'm going to get my infusion of one of these vaccines to pull that stuff out of my brain and also keep it from being deposited. And then maybe I won't get Alzheimer's disease, and maybe even if I do, it'll be pushed way down the road, or I'll get a real mild case. That's what we're looking at, and that's what we're hoping. And we'll know in the next 3 to 5 years. And these studies, all kind of versions of these studies are going on all over the United States. But they're available here in Texas, and they need volunteers. Now, the other one's called the SNIFF Study. The SNIFF Study, what they use is nasal insulin. And you spray it in your nose, and it goes up the olfactory nerve, and it goes up to the brain, to that underneath surface of the brain where Alzheimer's starts. That's where the olfactory center is, where the short-term memory is processed. And so it goes up there, the insulin does, and if you've got, they did it, the initial test they did on early mild cognitive impairment, like me. And what they did is they gave it to those people, and what happens is it forces glucose into the brain cells, even the damaging ones. And what happens is those brain cells work better, okay? And what they found in the early studies that when they did memory tests on people, their memory actually improved over the time that they were on it. So this study is starting up sometime this month also. And that one I can get in. I haven't decided if I want to do it or not. I'm after the thing that shuts it down. Okay, I want to shut it down. And then there's Alzheimer's blood test. Alzheimer's blood test. I don't know if y'all have heard about that. It's been in the news. These things are done all over the world. Research centers. They've come up, each center does a different version. They usually pick 10 lab things that they look at. Now, I'm in the study, the one up at UT Southwestern, and they look at 2 inflammatory markers and 8 proteins. And there's a panel, and they can predict within 90% accuracy in the study if you have Alzheimer's disease. Now, how much is that 90% accuracy? I always tell people 90% would be like When you go in and get a strep test, that quickie strep test, it's 90% accurate. When you go in and get that flu, you know, when they ram that thing up your nose, the flu test, that's 90%. That's 90% accurate. So the accuracy, that's about where they are. And so there's a company that's actually filed a patent, and so within 2 years, it's probably going to be available. So again, you have to be willing to know you're going to have Alzheimer's disease. I can tell you it's not an exciting thing to find out. But you can actually go in and get a blood test, and they can say with 9% accuracy, you have Alzheimer's disease. And maybe you don't have to have the spinal tap and some of these other things. And of course, like a lot of things in medicine, over time they get more and more accurate as they get better testing. So these are things you can do to help. If you want to slow your chances down, do these things. But I can tell you, that's what you tell your patients anyway to do, is these things right here, right? Okay? There's research being done on every one of these things in relationship to Alzheimer's disease. A lot of the research has been done over in Europe because they have access to the medical records over there. Also, a lot of the research has been up in North Texas. Some of the universities up there are doing it. Blood pressure control. So what I did, I decided, okay, I'm going to do everything I can to slow this down. So what can I do? So that's why I got on Aricept. And then I started doing all these things. And I kind of monkeyed around with blood pressure, and I finally gave it up to my friend that's a doctor, and so he's got me on medicine for blood pressure. Got it in really good control. Controlling your blood pressure. If you go to the doctor with memory loss and your blood pressure is out of control, they're going to stop right there, control your blood pressure, because that may be the answer. Okay? So control your blood pressure. Now there's a study just came out where they looked at a class of drugs called ARBs, angiotensin release. It's Divan and Atacand and Avapro. And what they found was, besides controlling your blood pressure, which helped, it also seemed to slow down the beta amyloid accumulation. It shuts the production down. So that particular blood pressure medicine may be acting 2 ways, controlling your blood pressure and shutting the process down a little bit. Lucky for me, I was already on the drug, so I didn't have to ask to get on it. Okay. Depression, anxiety, cholesterol is important. Diabetes is real important. Poorly controlled diabetes, 5 times increased risk for having Alzheimer's disease. The Mediterranean or MIND diet, eating a healthy diet. I changed my diet. I call myself a 90% vegetarian. I still have meat occasionally. Real aggressive with that. I maintain my weight. I'm very active physically, mentally, and socially. I limit my alcohol, red wine at night. I don't smoke. I am not stressful. I never get mad anymore. I don't know if it's because I retired from practice or if it's because of the Aricept. It may be the Aricept, I don't know. But my wife can't piss me off. She tries. And listening to music may help. So anyway, there's a lot of research. Sleep is my biggest issue because the Aricept interferes with my sleep. And so I lose sleep. I lose 1 to 3 hours sleep at night, but I'm retired and I can take a nap if I need to. So I get by. So that's all. And that's what everybody in this audit should be doing. It doesn't matter if you're going to get Alzheimer's disease or not. So how am I doing? My status. So 8 years ago, I was doing fine. I was in practice, seeing some of you people in here. I was real happy. And then I went up for that study, and I got my legs knocked out from under. It's kind of devastating to find out that you have something worse than cancer. And so I got on the Aricept, and I decided I'm going to do all these healthy things, and I've got real aggressive with doing it. Okay, and I've done that over the last 5 years. And so what's happened is every year, my memory has gradually improved. So that now, my last memory test was done in October, my memory is back to normal. It's normal. So I just make up a number. So there's an in-office test called a MOCA. normal is 27 or above. I scored 28. That's normal. I score better than some of my siblings, and I score better than some of my nephews that are younger than I am. Okay, and originally I started probably around 24, which is in the mild cognitive impairment range. So I went from 24. So something happened. I don't know what it is. I think it's the AirSep and doing all these things. And one thing, if you got a loved one on AirSep, don't say, I'm not giving that damn drug anymore and quit it. Don't do it. I would stop AirSep tomorrow if I could, because I hate the side effects. But it's possible that it's what's doing the trick. And if I stop it, I may be back down to where I was at. And then if I restart it, I won't gain it back. It'll be done. That'll be my new baseline. Okay? So something I'm doing is making a difference. So some research references. Remember, they're begging for people for these studies. And some of the studies even go down to 50. Well, some of the treatment studies are actually treating people in some of these studies that are 20 years old. You can imagine if you have a dominant gene, you're 20 years old, you got about 10, 15 years left. And so they're actually treating kids that are 20 in the studies. And all this information, a better handout is out there on the table. It has my name on it. I think it has my name on it. And it tells you better how to find this stuff. But one of the best ones is clinicaltrials.gov. It's the National Institute of Health website. And you click on there and you type in Alzheimer's disease and you click on map and it shows you the world. And you click on the United States and you click on Texas. And it shows you there's 160 studies been done in Texas. There's more than that, but they show about 160. Now, some of them have already completed. Some of them already filled up. But a lot of them, they're looking for people to get in the studies. So you can find studies, okay? Good website. The National Alzheimer's Association, if you go to their website and click on clinical trials, you can find information about clinical trials. You can also put in information and they'll hook you up with trials that fit your profile. This is my favorite one, Alzheimer's Texas, the new Alzheimer's Texas, that's sponsoring this thing. So if you go on their website, they have a thing that says research, click it, and it links you to some of these. So if you go there, you're going to find what you need, okay? And then the Alzheimer's Center at UT Southwestern in Dallas, they have a website, and the official link is out there on that handout. And if you click on that and you go to the next page, you'll see this doctor talking to me. And you click on that, it's a video. Because they did a video where they interviewed my wife and I, and they interviewed the doctor that takes care of me. So it's about a 3 or 4 minute video. And also they have a list of all their studies that they're doing. Okay. I'll advertise my blog. I have a blog. I do it on Fridays. I do it every day, but on Fridays I do it on Alzheimer's disease. Like yesterday I did it on doing this talk. And I'll do it, I do it, I may write about how I feel about, if I have to go up there and do all this testing, I'll write about how I feel, and I usually try to write when I get back, and I try to let people know what's going on. And I do, like a couple weeks ago, I did one on the PPIs, like Miprazole and Prelisac and all those, and dementia, and I wrote on that, because I take that stuff, and it made me kind of worry. But I decided to stay on it. And then TARC, that's an association of universities here in Texas. That's an association here in Texas. I forgot how many universities, it's 10, 12, whatever number it is. They do a lot, they share research, and I think they're doing that Alzheimer's blood test study that I'm in. I think that's the one I'm in, because I'm in their research stuff. Okay? So now you can ask me questions. I've got whatever